Welcome back to our channel. Today, we're delving into a topic that's crucial for anyone who's concerned about their kidney health. 10 common medications that can harm your kidneys. Our kidneys are vital organs responsible for filtering waste and toxins from the blood, balancing fluids, and regulating various bodily functions. However, certain medications, even those we commonly rely on, can pose risks to kidney health if not taken with caution. In this video, we'll explore 10 common medications that can harm your kidneys, how they affect kidney function, and what you can do to minimize the risks. We'll also discuss the signs of kidney damage, and offer tips on how to protect your kidneys while managing your health with necessary medications. Whether you or a loved one is currently taking any of these medications, it's important to be informed about potential risks and how to mitigate them. So, make sure to watch the video until the end for valuable insights that could help safeguard your kidney health. Number 1. Non-steroidal anti-inflammatory drugs. Let's start with one of the most commonly used medications, non-steroidal anti-inflammatory drugs, or NSAIDs. These include popular over-the-counter pain relievers like ibuprofen, Advil, Motrin, and naproxen, Aleve. How they affect the kidneys. NSAIDs work by reducing inflammation and pain, but they can also reduce blood flow to the kidneys, which impairs their ability to filter waste from the blood. Prolonged or excessive use of NSAIDs can lead to acute kidney injury or chronic kidney disease. They also increase the risk of developing kidney stones due to their effect on kidney function. Who is at risk? The risk is higher in people with pre-existing kidney conditions, the elderly, those with heart disease, and individuals who are dehydrated. Even healthy individuals can experience kidney damage from long-term use of NSAIDs, especially in high doses. What you can do to protect your kidneys: use NSAIDs sparingly and only as directed. If you need to use these medications frequently, consult your healthcare provider for alternatives or strategies to minimize risks. Staying hydrated and avoiding alcohol while taking NSAIDs can also reduce the strain on your kidneys. NSAIDs are effective for managing pain and inflammation, but being mindful of their impact on your kidneys is essential to avoid potential harm. Number 2. Proton pump inhibitors. Next, we have proton pump inhibitors, or PPIs, a class of medications commonly used to treat acid reflux, heartburn, and gastroesophageal reflux disease, GERD. Examples include omeprazole, Prilosec, and esomeprazole, Nexium. How they affect the kidneys. PPIs reduce the production of stomach acid, which is effective for treating acid-related conditions. However, long-term use of PPIs has been linked to an increased risk of chronic kidney disease and acute kidney injury. The exact mechanism isn't fully understood, but it's believed that PPIs may cause inflammation in the kidneys or lead to a condition called acute interstitial nephritis. Who is at risk? Individuals who use PPIs for extended periods, especially without medical supervision, are at a higher risk. The elderly and those with pre-existing kidney conditions are also more vulnerable. What you can do: if you're taking PPIs, it's important to use them under the guidance of a healthcare provider and only for the duration recommended. If you require long-term management of acid reflux or GERD, ask your doctor about alternative treatments or lifestyle changes that could reduce your reliance on PPIs. PPIs can be life-saving for those with severe acid-related conditions, but being aware of their potential impact on your kidneys can help you make informed decisions about your treatment. Number 3. ACE inhibitors and ARBs. Angiotensin-converting enzyme, ACE, inhibitors and angiotensin II receptor blockers, ARBs, are commonly prescribed for managing high blood pressure and heart failure. Examples include lisinopril, Zestril, and losartan, Cozar. How they affect the kidneys. While ACE inhibitors and ARBs are generally beneficial for people with kidney disease or high blood pressure, they can sometimes cause issues when used inappropriately. These medications work by relaxing blood vessels, which can reduce blood flow to the kidneys and potentially lead to kidney injury, particularly in people with existing kidney disease or those who are dehydrated. Who is at risk? Patients with pre-existing kidney disease, those who are dehydrated, or individuals taking high doses of these medications are at a higher risk of kidney complications. The risk is also elevated when ACE inhibitors or ARBs are taken in combination with NSAIDs or diuretics. What you can do, if you're prescribed these medications, it's important to have regular kidney function tests to monitor their impact. Staying hydrated, avoiding NSAIDs, and following your healthcare provider's dosage recommendations can help reduce the risk of kidney damage. ACE inhibitors and ARBs are critical for managing certain health conditions, but they require careful monitoring to ensure they don't adversely affect kidney function. Number 4. Diuretics. Diuretics, often referred to as water pills, are commonly used to treat high blood pressure, heart failure, and certain kidney conditions. Examples include furosemide, Lasix, and hydrochlorothiazide, Microzide. How they affect the kidneys. Diuretics work by increasing the amount of urine your kidneys produce, which helps remove excess fluid from the body. However, this increased urine production can also lead to dehydration and electrolyte imbalances, which can strain the kidneys and lead to acute kidney injury. Long-term use of diuretics can also contribute to a decline in kidney function, particularly in those with pre-existing kidney conditions. Who is at risk? The elderly, people with heart or kidney conditions, and those taking diuretics in combination with other medications that affect kidney function are at a higher risk of kidney damage. What you can do, if you're taking diuretics, it's important to stay well hydrated and monitor your electrolyte levels regularly. Your healthcare provider may also recommend periodic kidney function tests to ensure that the medication isn't causing harm. If you experience symptoms like extreme thirst, dizziness, or muscle cramps, contact your healthcare provider. Diuretics are effective for managing fluid retention and high blood pressure, but understanding their impact on your kidneys can help you use them safely. Number 5. Antibiotics. Antibiotics are essential for treating bacterial infections, but some antibiotics can be harmful to the kidneys, especially when used improperly. Common examples include gentamicin, vancomycin, and certain cephalosporins. How they affect the kidneys. Some antibiotics are known to be nephrotoxic, meaning they can cause damage to the kidneys. This can occur through direct toxicity, allergic reactions, or by causing a reduction in blood flow to the kidneys. In some cases, the damage can be temporary, but in others, it can lead to permanent kidney injury or even kidney failure. Who is at risk? People with pre-existing kidney disease, the elderly, and those who are dehydrated are at a higher risk of experiencing kidney damage from antibiotics. The risk is also higher when antibiotics are taken in high doses or for extended periods. What you can do, if you're prescribed antibiotics, it's important to take them exactly as directed and complete the full course, even if you start feeling better. Avoid self-medicating with antibiotics, and inform your healthcare provider if you have a history of kidney issues. They may adjust the dosage or choose a different antibiotic that is less likely to affect your kidneys. Antibiotics are crucial for fighting infections, but being mindful of their potential impact on your kidneys can help you avoid serious complications. Number 6. Lithium. Lithium is a medication commonly used to treat bipolar disorder and other mental health conditions. While it can be very effective, it also comes with risks to kidney health. How it affects the kidneys. Long-term use of lithium can lead to a condition known as nephrogenic diabetes insipidus, where the kidneys lose their ability to concentrate urine, leading to excessive urination and thirst. Over time, this can cause chronic kidney disease and even kidney failure if not properly managed. Who is at risk? Individuals taking lithium for extended periods are at a higher risk of kidney damage, especially if they have other risk factors like high blood pressure or diabetes. Regular monitoring of kidney function is essential for anyone on lithium therapy. What you can do: if you're taking lithium, it's important to have regular blood tests to monitor the levels of the medication in your body and ensure your kidneys are functioning properly. Your healthcare provider may adjust your dosage or recommend protective strategies to minimize the risk of kidney damage. Lithium is a powerful tool for managing mental health conditions, but its potential impact on the kidneys requires careful monitoring and management. Number 7. Statins. Statins are a class of drugs used to lower cholesterol levels and reduce the risk of heart disease. Common examples include atorvastatin, Lipitor, and simvastatin, Zocor. How they affect the kidneys. While statins are generally safe, they can cause a rare but serious side effect known as rhabdomyolysis, where muscle tissue breaks down and releases a protein called myoglobin into the bloodstream. Myoglobin can be harmful to the kidneys and can lead to acute kidney injury or even kidney failure. Who is at risk? The risk of rhabdomyolysis is higher in people taking high doses of statins, those with pre-existing kidney disease, and individuals taking statins in combination with other medications that can increase the risk of muscle damage. What you can do: if you're taking statins, be aware of the symptoms of rhabdomyolysis, such as muscle pain, weakness, and dark-colored urine. If you experience any of these symptoms, contact your healthcare provider immediately. Regular monitoring of kidney function and muscle enzymes can help detect any early signs of kidney damage. Statins are an important part of managing cardiovascular health, but understanding the potential risks to your kidneys can help you use them safely. Number 8. Chemotherapy drugs. Chemotherapy drugs are powerful medications used to treat cancer, but they can also have serious side effects on the kidneys. Examples include cisplatin, methotrexate, and ifosfamide. How they affect the kidneys. Chemotherapy drugs can cause direct toxicity to the kidneys, leading to a condition known as chemotherapy-induced nephrotoxicity. This can result in acute kidney injury, chronic kidney disease, or even kidney failure. The damage occurs because these drugs are often eliminated through the kidneys, leading to high concentrations in the kidney tissues. Who is at risk? Cancer patients undergoing chemotherapy, especially those with pre-existing kidney conditions or those receiving high doses of nephrotoxic drugs, are at a higher risk of kidney damage. What you can do: if you're undergoing chemotherapy, it's important to stay well hydrated and follow your healthcare provider's recommendations for protecting your kidneys. This may include taking medications to reduce the risk of kidney damage or adjusting the dosage of chemotherapy drugs. Regular kidney function tests are also essential for monitoring any potential damage. Chemotherapy is a critical tool in the fight against cancer, but taking steps to protect your kidneys during treatment can help prevent serious complications. Number 9. Antiretroviral drugs. Antiretroviral drugs are used to treat HIV, AIDS, and can be life-saving, but some of these medications can also pose risks to kidney health. Examples include tenofovir and indinavir. How they affect the kidneys. Certain antiretroviral drugs can cause kidney damage by affecting the tubules of the kidneys, leading to conditions like Fanconi syndrome, where the kidneys are unable to properly reabsorb nutrients and electrolytes. This can result in chronic kidney disease or acute kidney injury if not managed properly. Who is at risk? Individuals with HIV/AIDS who are taking antiretroviral drugs, especially those with pre-existing kidney conditions or those taking high doses, are at a higher risk of kidney damage. What you can do: if you're taking antiretroviral drugs, it's important to have regular kidney function tests to monitor their impact. Your healthcare provider may adjust your treatment regimen or recommend strategies to protect your kidneys, such as staying hydrated and avoiding other nephrotoxic medications. Antiretroviral drugs are essential for managing HIV/AIDS, but understanding their potential impact on your kidneys can help you manage your treatment safely. Number 10. Herbal supplements. Finally, it's important to note that not all medications that can harm your kidneys are prescription drugs. Certain herbal supplements, often taken for their perceived health benefits, can also pose risks to kidney health. Examples include aristolochic acid, found in some weight loss supplements, licorice root, and certain Chinese herbs. How they affect the kidneys. Some herbal supplements can be directly toxic to the kidneys, leading to conditions like interstitial nephritis or even kidney failure. Others can interact with prescription medications, increasing the risk of kidney damage. The lack of regulation in the supplement industry also means that the potency and purity of these products can vary, leading to unintended consequences. Who is at risk? Individuals who take herbal supplements without proper guidance, those with pre-existing kidney conditions, and those taking multiple medications or supplements are at a higher risk of kidney damage. What you can do: before taking any herbal supplement, it's important to consult with your healthcare provider, especially if you have a history of kidney issues or are taking other medications. They can help you understand the potential risks and ensure that the supplement is safe for you to use. Herbal supplements can offer health benefits, but being aware of their potential impact on your kidneys is crucial to avoid unintended harm. And there you have it, 10 common medications that can harm your kidneys. While these medications are often necessary for managing various health conditions, it's important to be aware of their potential impact on your kidney health. By staying informed, following your healthcare provider's guidance, and taking proactive steps to protect your kidneys, you can reduce the risks and ensure that your treatment supports your overall well-being. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to our channel for more health tips and information on how to maintain a healthy lifestyle. And as always, if you have any questions or suggestions, feel free to leave them in the comments below. Thank you for watching, and take care of your kidneys. They work hard every day to keep you healthy.